Hello and welcome. Thank you for joining us to our training session for the week. Today we'll be doing our preparation series to bring ourselves in better alignment for when we start lifting weights for bone density building. We'll be leg strengthening, core strengthening, and always we do some special work to take care of shoulders and other areas like feet. And I'd like to always start working on the pecs. So if you could get a massage ball, most people have some kind of tennis ball, or this is a cork ball. I find the cork balls work really well. So we're working here along the chest muscles, but specifically I like to work on the subclavius. It's right between the clavicle, your collarbone, and the first rib. Many of us, the first rib gets jammed, and that prevents us from moving our arms up overhead proficiently. The head should always be turned away from the ball. I'm here in a door frame. It's way more comfortable for your neck angle, and you can get deeper into your pectoral muscles here. Be sure to work out the outer edge by the underarm area. You might lift the arm up somewhat. And around the front of the arm, the humerus bone, the head of the humerus and the rotator cuff, that front edge. Okay, now when we work on the other side, so here I'm going to be able to demonstrate the arm. So your head is turned away and down. So you're working from the chest bone, the sternum, and along the edge of collarbone, in between the collarbone and the first rib. And when you get toward the outside of the ribs, you can lift the arm up and even go diagonally across the tendons of the pectoral muscle here and in toward the underarm. Okay, and the next area I always like to work on is preparing the feet. Something very common. So here today I have my toe spacers on. Being in the northern climate, our feet wearing shoes and boots, our toes really, unfortunately, our feet have become deformed for that reason, particularly people who have wide feet. So rather than just rolling, you might put some pressure, not on your heel or wherever it's like specifically sore, but on the plantar fascia and the outside arch of your foot. So on the outer part, just above the heel. In the forefoot also, kind of at the base of the second, third toes, there should be an arch in that part of our foot. And because of shoes, then the toes get angled in, we lose that arch. A lot of people have like that Morton's neuroma, things like that. Other foot. So the toe spacers, compared to arch supports, they weaken the arch because they're doing the work instead of your arch working. And when you wear like toe spacers like this, it forces the toes to spread, so the muscles that keep the toes apart have to work and they get stronger, so it makes your arch stronger. All right, so next we're doing a series of exercises on the floor. And for this purpose, you'll need still this massage ball and a strap, like a yoga strap or a karate belt, a broomstick, and a foam roller or a rolling pin. For rolling out the quads will do. And also for our spine strengthening, if you have a stability ball, or I use a stool or some kind of ottoman. If you don't have that available, you can just always do a bird dog variation without that. All right, so things consistent amongst all of us. the upper trapezius muscle. You know, we sit at computers, our heads go forward, so the upper traps right here, for many people, it just gets really hardened, and that, you know, you can't get your shoulder blades and head in the proper position. So I'm starting on the right side, and the ball's just at the base of the neck towards on the right side. And if you bring the arm up, then you can just put some pressure or roll around a little for your upper traps, so the other muscles like the levator scapula that lift the shoulder blade up, attached to the spine here. Okay, and then if you could move the ball slightly to the side, so there you're now more in the belly of the muscle and the supraspinatus muscle. And now a little further to the side and a little back, and you'll feel the edge of your shoulder blade. And you can feel the attachments of the tendons. It's often like a string. Everyone will have a little different sensation here, some a little higher, some a little lower, or maybe it's tight or sore. But that's the idea. Allow the shoulder blade to move more freely. Okay, and now we'll do the same thing on the other side. Just at the left, just at the base of the neck. And the arm up, that helps to release the tension a bit so you can get deeper into the joints. And now in the belly of the muscles here in the middle, we do this every day, so mine actually it's not really very hard, sometimes a bit stringy. And then more toward the edge of the shoulder and down the back an inch or two on the edge of the shoulder blade. All right, and next area we're going to just work on the hip, the socket of the hips. So on the right side, you just lift the hip up a little and then put the ball not way under, like in the thick part of the glutes, really more on the outer edge. And if you straighten the right leg, and then you can turn on top of the ball and it will sink in right at the edge, the top of your femur, the head of your femur. And here you might find, you know, a tight tendons. You can just press on them a little. Or you can massage around as you like to. So when we do our, you know, leg strengthening, your legs will move through a better angle in your hip joints. And of course, every day, just care of your hips. And now if you turn on the back, and you can bring the ball further down around the edge of the femur, and in between your femur and the tailbone. Many people have landed on their tailbone, so some people it's very sensitive here. Okay, and now we'll work on the left side. So you lift the hip up, left leg straight, turn up on top of the ball. Best if the head and the shoulders, like everything should be quite relaxed here. If it's very sore, you know, your leg might tense up, so you're doing your best to keep your leg very relaxed. And with regular care, your hip will just be overall healthier. I'm sure many of the hip replacements are preventable, but some definitely not. Some are definitely much better off having had the hip replacements. But there and again, we didn't do this kind of care earlier in our lives, some of us. Okay, more on the outer edge here. And then turn onto the back again. So down the lower edge of the hip, in between the femur and the tailbone. Okay, great. So next we'll put the ball behind the head and behind the skull. Okay, so it's not in your neck. We're just leaving it in the skull. And when the chin is angled down, it helps lengthen the muscles along the spine. And first we're just going to nod up and down like this. Not so much up, but more the down angle to many of us, the neck becomes too curved, hyperextended, and the muscles at the back of the neck become very tight. And then just take a deep breath. And the nodding action again. Relaxing the shoulders. And one more deep breath. And now only the eyes look up and down, keeping the chin in the down position when the neck lengthened. And a breath. Then eyes only up and down. This helps release the suboccipital muscles in the back of the neck. Again, they get tight when our heads are forward angled. Okay, and we'll put the ball now away. Of course, you could always spend a lot of time doing that, but for the class, we need to get the training, the strengthening, and more importantly. So here I have the strap. You can see that. And we're going to put the strap under the right foot. Take both ends of the strap and wrap it around the back of the calf, and then hold on with the right hand. So the knee should be here directly over the hip joint, so the femur is like that vertical, foot is flexed. And then we're just going to rotate the femur in your hip joint. If your hamstrings are tight, you might not be able to straighten the leg. You can have the leg even like this at a 90-degree angle, but the knee should be directly over the hip, and you be sure not to twist the knee or ankle. Your leg in either angle is stiff, very stiff, so the rotation is in the hip joint. And then we'll unwind it and just do a stretch. Again, I just always say knee over hip. And if the knee's a little flexed, that's okay. Be careful, you don't want to hyperextend the knee, so the knee here shouldn't go backwards. Other leg, right leg is straight. So we're in the left foot, take the strap, right hand, wrap it around the back of the calf. The knee is over the hip. You don't need to pull it close to you like that. And toes pointing straight back. Then you just rotate the femur. It's much like a screwdriver. Your leg is stiff. It can be a bent handle, that's okay, but keep the knee directly over the hip joint. So we're internally and externally rotating the femur. Then unwind and just stretch. Okay, and the broomstick. Now this is to set the angle of your pelvis. The right leg is knee over hip and the stick is behind the right leg. Then pull the left leg up into it. So you're pushing away from you, the hamstrings of the right leg, pulling toward you, the quads of the left leg are in contact with the stick. Okay, and switch to your leg position. Okay, and left leg here, you're in the hamstring pressure, push away. Right leg, quads, you're pulling toward you. And always the bar is parallel to the floor. Okay, and broomstick away. Then to stretch the chest, you take the arms out like this. This is to help get better blood flow, help, towards preventing arthritis and other numbness into your hands, tingling down the arms. Keep the chin down a little. You always want to lengthen the back of the neck and just reaching across. And now envision a stability ball, one of those big stability balls that's on your abdomen, and you would like to wrap your arms around the ball and wrap the legs around it and really envision the ball. Then we're going to just rock side to side. And if you keep holding the ball in place, it will force you to use your rotational core stabilizers. If you're falling apart and your back is arching, not to worry, we're going to do exercises to help you be stronger in your abs all the time. Okay, and rest. So this is my favorite dead bug variation. You bring the arms up to the sky, bend the elbows at a 90 degree. The legs at Knees over hips, 90-degree angle. Lower back, slight arch in the lower back, little neutral spine. And right leg forward just a few inches, hold. You should feel your abs, lower abs engage without hyperextending or flattening your back. Right leg back and left leg. So always there should be this slight arch lower back. It shouldn't increase or decrease as you're adjusting the leg angles. Right leg forward. Keep the chin down and shoulders relaxed. Right leg back, left leg. We're only doing a couple reps. Here it's like activation of your abs. We'll be doing more strengthening later on. Next, the spine rotation. So I'd like to start like this, lying on the right side. You take the left leg forward. With your left hand, reach behind so the right leg goes back. And you reach in the direction of the foot. So left hand, right foot, right hand here on the left knee. Most important though, the shoulder. The shoulder is back and the knees forward. And both are equal distances from the floor. Like don't just roll the knee forward. That will over-rotate your pelvis and lower back. Okay, now we'll turn on to the other side. So left leg straight, turn on to the left side. Right hand, reach behind in the direction of the left ankle. Left hand is on the right knee at the front. Okay, so the shoulder's back and the knee is forward, both same heights from the floor. Always thinking of lengthening the spine. Here, like right-handed rotational activity, sometimes gardening or golfing or baseball, that people who are right-handed, that will cause this right side to get really tight and you get back pain and all. Okay, we're going to do that again a little quickly. We're just going to strengthen the neck first though. If you take your hands either on your abdomen or under the lower back, right leg bent, left leg is straight. First action is to think of lengthening the spine. So that will pull your chin down toward the throat. So this is to strengthen your neck. So if you can lift the elbows, if you can do it. Now to lift the head, you must keep the chin pulling toward the throat. The chin shouldn't go away from the throat. Keep lengthening and chin toward throat. Those actions together. And then down. Relax the legs. Okay, again, lengthen, chin down, elbows come up a little if you can. And if you can do it, you lift the head. If your head is too heavy, you can't do that yet. Your muscles are not strong enough. Don't lift the head. And down. Priority is keeping the chin in place, not lifting head. Switch legs, left leg up, right leg is straight. Okay, lengthen first, chin down, elbows come up, and head up if you can. Take a deep breath. And rest. Once more, lengthen, chin in, elbows, head up if you can, and breath. Okay, rest. Now, a little quickly, we're going to go through that alignment series again. Strap under right foot, and this time we're just going to do a stretch. So regardless of how straight your leg is, the knee is over the hip. Toes and knee are pointing straight back towards shoulder direction. Just note if your ankle or knee are a little twisted, straighten yourself out. And then switch to the left leg. Right leg is down. Of course, you could do these longer, but from here we have a lot to fit in. Knees and toes pointing straight back. A lot of people have a torque in their left ankle from, ankle sprains and other factors. Myself included. Those ankle sprains we did as children. So you always check, make sure we're aligned. Okay, and we'll put the strap down and brace it. Okay, so hamstrings right leg, quads left leg, pressing the bar. Shoulders are centered and hips are centered on the floor, and chin toward the throat. Pressing the legs. Reverse the legs. With regular practice, it feels even on both sides. Usually when people start out, you'll notice it's a bit off track. Press the legs. Okay, bar down. And wide angle with the arms. And this cradle rock position, again, this time we're just going to do a hold. So if you can set up and rock over to the left and hold, find your balance point. And when your core is like really holding you together, rotate to the other side, holding the pelvis and ribs in place. When you get this balance point, it's really quite effortless. Turn onto the back. And just quickly the dead bug angle, arms up and legs up. Right leg forward a few inches. Small breath, exhale. Leg back, left leg. As you exhale, contract the lower abs, lift pelvic floor. Left leg back, right leg forward. And left leg. Okay, spine rotation once more, lying on the right side. And top leg forward. Bottom leg back. If the hamstrings cramp, then it's just usually a sequencing issue with the glutes not firing. Often the first time people cramp, second time not. Okay, other side. So if you tend to cramp, when you think of bringing the left leg back here, you think engage your glute and then see if you can offload the hamstring. Should be glutes first. All right, then from here, we're going to roll out the quads, and you can either just sit up if you have a rolling pin. A lot of people can sit in a chair and roll out their quads. It feels great. It works really well, actually. If you have a foam roller, I would do one leg at a time. If you put both legs on it, the big ones, it makes your back hyperextend. So we'll start with the right leg. The roller is just above the knee. And always we want to make sure we have our good plank position here, and we're just going to roll incrementally without letting your lower back hyperextend. So your waist, you shouldn't be sagging in your waist here. Eyes looking down to the floor. If you look forward, that will make the neck hyperextend or arch too much. And then when we get to the top, on the front of the hip, in the hip flexors, and then turn just a bit to the side here. This is called the tensor fascia lata. The roller will sit in the groove here in your hips. The importance of that is it attaches to the IT band. Okay, then we'll do the left leg. So just above the knee. And as we're rolling, I like to adjust my leg angle slightly so you're on all the different quadricep muscles, not just the middle. Not directly on the side of the leg, but more on the outside, the front, and a little bit on the inside. And of course, you can spend a lot of time foam rolling, but today we're just hitting the main areas. And now we'll turn again onto this outside of the hip on the TFL. Okay, and so for the multifidi, or the spine stabilization work, today if you have a stability ball, if that's too wobbly for you, you can just use a stool. I just don't like plastic, so I just use this instead. We're going to do 2 sets of just a torso lift. If you do not have a ball or a stool or something or an ottoman, instead you would just do like this. This is the quadruped position, bird dog exercise, but you'll just lift one arm only and hold 5 seconds. So we'll do a set of that, and then we'll go left arm only and a set of that. Today we'll just do the arm lifting. The people here on the ottoman, we're just going to do 2 sets of 7 of torso lift. Okay, the torso lift group. The feet are on the floor, the legs are straight. The bird dog group, hands and knees. The ottoman group, you might have to have your hands supporting if your back's not strong enough. or you can have the hands like this in lower back. Okay, so everybody get your set position. Everybody tuck the chin. Brace your lower back. The bird dog group, right arm lift, hold 5 seconds. Other group, hinge down just a few inches and then hinge up, always bracing the lower back. The torso group, hinge down and lift. You don't want to be rounding your lower back when you do this. Think more about like a hinging action at the hip. It's only a few degrees, and then lift. If you go too low, most people just over flex the spine. We don't want to do that. Down and lift. Everybody make sure the chin is tucked in and hold. Down and lift. Okay, now always most important is the lower back area. Think of bracing the lower back. Down and lift. Maintain that brace. Down and lift. Hold. And one more. And hold. Okay, and recover for a moment. So the bird dog, you probably need to get off your wrist for a second here. So the lower back, how do you brace your lower back? I just imagine a heavy plate is sitting on the lower back. And think of engaging your lower abs. That helps to lift your pelvic floor. Imagine that plate on your lower back. And that will help those muscles, the Ltwt, to fire. Okay, now the bird dog group, you're going only left arm, other group, hands either on the floor or lower back. Everybody chin tucked in. Okay, then hinge down a few inches. Brace your lower back, lift, hold. Bird dog group is doing left arm only lift. Down and lift. Of course, all of us are aiming here to be stable. Down and lift. Right side, left side, even. Bird dog group. Down and lift. The hips should be level. The back shouldn't be shifting around. Down and lift. 2 more. Down and lift and hold. Down and lower abs engage. And rest. Right, great. Then from here, we're just going to stand up. As you like. And you might be a little dizzy from the blood pressure changes. Okay, so we prepare our back. We're just going to do one thing here for the feet, actually. So before we start our deadlifts, I like to do deadlifts because it's full body strengthening. And with a heavy load, with deadlifts, you can lift heavier than a lot of other lifts like squats. And so you get more like strength and bone density building out of it. Okay, so here I have just a towel that's rolled up. We will use this regularly, so if you can have one in nearby every time you have a class. And so it's unfolded just that bottom, so you have that support, and you have only the toes are on it. So the balls of your foot, your feet, your balls of your feet, the forefoot is on the floor, only the toes are up. And the toes you'll see will be straight. And then if you lean forward, the toes are lengthened, and that will press the toes, and your toes will strengthen, and then lean back. We're going to do a set of 20, lean forward, press the toes. Try not to scrunch the toes, lean back, lean forward, press. Your heels don't have to come off the floor. Lean forward and press. Lean back. And just do this at your pace, lean forward, so that you feel the toes engaging, and lean back. When the tendons are in their lengthened position, so we're just leaning forward and then lean back. And it's not a bend forward, you're just leaning forward like you're going to fall on your face, and then lean back. Lean forward, the toes will press, and lean back. Lean forward. So you get maximum strength gains. There was a study actually when the toes are in their lengthened position like this, and you do toe strengthening, you get 4 times better results than if you do like toe scrunches, lean forward. Then fall prevention, strengthening our feet and ankles is a big part of our training program. And one more. And this last time, just lean forward and hold. So you're just slightly angled forward. So this is called the fall envelope, how far you can lean forward without falling on your face. And when you strengthen that, obviously, the more it is, the less likely you will be to ever fall. Now, besides falling, the importance is that your feet are stronger, so you're just more capable in life. All right, that was great. All right, so next thing, if you could get for yourself whatever you consider to be a heavy weight, according to you. And we're going through our deadlift series. We'll be going through today multiple angles, because it helps to open up the hips in different ranges of motion. Just going to put this away for a second. Particularly up here in the north, we know soon the snow and the ice. And already there have been a few incidents that I've heard about. Okay, so the first set of deadlift is a hip hinge. The weight, be careful of this, the weight should always travel vertically between the feet. Not if you go forward like that, it strains your back. This is a hip hinge, you push the hips back. That action will engage your glutes and abs and not strain. It'll be protecting of the lower back. The feet are just slightly wider than hips, toes a bit angled out. We're going to do a set of 25. Okay, both hands are holding on to the weight for this first set. Everybody tuck the chin in. Think of keeping the spine lengthened. Push the hips back, hip hinge, and think of engaging the glutes to stand up. Hips back and squeeze your buttock muscles, but from the sides. So imagine the sides of your hips are squeezing in as you're standing. Like someone's got their hands on either side of your hips and they're squeezing your hip together each rep. And rest. Okay. And just walking a little forward and backwards. So for most people after the age of 50, they lose 2% of muscle mass each year. So that means by the time you're 75, you've lost 50% of your muscle mass, most people, okay? But that doesn't have to happen. The protocol we use with our strengthening is to help prevent that and actually to help you get stronger. Next, we're doing a wider stance like this and only one hand holding onto the weight, okay, like this. The palm is facing forward and still is this kind of hip hinge, so your hips will travel back and forth. What you want to be careful of is you don't let the hips go like side to side, so the hips are traveling directly forward back. Left hand has the weight. Palm is forward to externally rotate the shoulder. Same thing, hip hinge back and engaging the glutes equally, right and left, keeping yourself centered. Avoid leaning down to the left side, so you're thinking of keeping the chest facing forward, shoulders level, always the chin is tucked in. We're doing a set of 15. Make sure you're pushing the hip back. If you just bend your knees, then you'll feel it pressing into your kneecaps. Shouldn't feel that. You will for sure feel the legs working. That's good, but not pressure in the kneecap. Okay, and weight down. Brilliant. Walking forward and back. Okay, now in terms of brain function, walking backwards or doing exercise backwards has been shown to improve cognitive faculties. where legs are out to the side. Right arm, set to 15, palm face forward, and hip hinge. And rest. Okay, and then walking. Okay, and one last set we'll do. So this high rep, between 25 to 30 reps, 3 to 4 sets has been shown to help build muscle tone, and at the same time, people don't get injured because especially when you get older, you'll try to lift heavy weights. Sometimes people can't do that with good form. Both hands holding on again, feet are out to the sides, chin tucked in. Think of bracing the lower back like we did earlier, brace your lower abs. Okay, hip hinge back, and as you stand, exhale and pull the lower abdomen in. So contract the lower abs. Think of lifting your pelvic floor. Those of you who have an idea what that means. Exhale as you stand. And rest. All right, good. And we'll put that weight down. And for recovering, it's good to just walk around a bit. That also does help the fascia and help with your assimilation of the training. Okay, so just walking. And so next part for overhead strengthening. Today we're going to do carries. I love this because it's so efficient in building up your bone density and your overall strength. We're starting with overhead. So we're just going to be carrying a weight, okay? Carrying weight. And we'll carry first like this, overhead if you can, and then shoulder level and down by the side. The weight distribution, if you have options, it's best this one, like maybe 5 pounds, 10 pounds, 15 or 20 pounds, or something like that, like 2 pounds, 5 pounds, 10 pounds, if you have those options. Okay, so I'm starting with a 10. Now, some people won't be able to lift overhead. So if it's uncomfortable for you to go overhead like that, then instead when we carry shoulder level, it looks like this. The hand is in front of the shoulder and the elbow tucked in like that. Okay, like this. And in that way that you maximize your core. So we're going to, I'll count steps a few times here. Left arm is holding on first. So if you can do it, you go arm overhead. And just walking forward and backwards. So as simple as this is, the multiple factors that here we're working on. First of all, because you're carrying something heavier than your body, that will stimulate your bones to get stronger and your muscles to become stronger. Weight down. Typically you would do this longer. I'm just doing it a little short so we can get all the sets in. Right arm up. Keep the shoulders level, keep the chin tucked in. In terms of spine health, these carries really do help strengthen the muscles that support the spinal alignment. Because the weight is pulling diagonally across the spine, and we do it evenly in all directions. Weight down. So those diagonals across the vertebrae will help hold the spine in better alignment. So here we're carrying shoulder level, and I started with 10, now this is 15. Elbow tucked. The weight is directly in front of the shoulder. Keep the chin in. Okay, now in terms of your abs, right, that your abs automatically will have to engage. Do your best not to let your back hyperextend. And obviously you're doing your best to walk in a straight line. And down. Okay, right arm, elbow tucked in, hand right in front of shoulder. You're really tall, keep the chin in though, and walk forward and back. And now up the feet, of course. Your toes are angled forward. And since we did our foot strengthening earlier, you should be able to have a good range of motion, bending the toes, weight down. And left hand with the heaviest weight, so the running at 25. And we're doing our best. Now this is heavier, so you'll lean a bit to the side depending how heavy it is, but you're aiming to try to stay up straight and walking forward and back. If it's heavy according to your body weight, it's natural to lean to the side a little, but in strengthening your shoulders and core, you will not hurt your back. As opposed to, sometimes carrying like mulch bags and other dog food. Down, other side. All these awkward angles. Well, you've trained your body. Right arm standing tall, chin back. Keep the shoulders slightly back. Make sure you're not leaning forward. And note how your abs are engaged automatically. The forces also are across your feet and knees, right? And you're working against getting rotated, pulled over to the side. So if you're outside and you slip a little, you've trained yourself how to be stable. All right. And next we'll put that weight away. Okay, we're going back to strengthening the hips, and this is really fun. So last week we did some kind of agility work. This is kind of similar, but if you have, this you might get also, we'll do this from time to time. This is like a happy sack, this little beanbag thing. But if you have it, if you don't really need it for today, but it's a good thing to do regularly. And a pair of socks, and you just roll up a ball of socks. That will really work too. So the exercise, why we're doing this, is to strengthen your femur where it attaches to your hip joint and take it to a full range of motion. So there's strengthening, balancing of the feet and ankles, and also releasing and opening up your hips. But the knee part, everybody, you have to be sure you don't let the knee twist, If your ankles are restricted, if your hips are restricted, knees will give out. So just be sure you watch out for the knee rotation. Okay, so I have this in the forefoot, like right under here in this part of the foot, and so the toes are kind of wrapped around it. If you don't have it, you don't need it. You just move your foot back and forth. So what we're going to do is like this. You take the leg forward and then take the leg back. So we're going to flexion and extension. Okay, and then just rest for a moment. So that's the idea. We're going forward and backwards. So we're going to start with the left foot is stable. Your toes are forward. Right foot, if you have a ball, or not a ball won't work, but something like socks, right? And you just grip it in the forefoot. Okay, and we're taking the foot goes forward. Push the hips back a little as you do that. And then slide the leg back behind you. So here you're doing your hip hinge. So you should feel that in the front leg glutes. Use the glutes as you bring the leg forward. Keep using the glutes, not just the quads. Slide back. This will help strengthen the knee joint, but be sure you keep that knee centered. Slide back. We'll just do 2. Slide back to center. So fundamentally think about the hips. So that moved your legs, through flexion and extension. So we'll switch to the other foot. So right foot, toes are angled forward. Left foot, you're gripping it in the forefoot if you have it, or you just have your toes on the floor. Okay, then knee. Make sure knee doesn't dive in here. Okay, leg goes forward, knee is centered, relative to the toes, then slide back. The left foot also should be pointing forward. Now you get back into the right hip, so feel the right glutes here. Right glutes, stand up. That's the way you use the glutes. And forward. And then back. As you slide back, use the right glutes here. Keep the chin in. Glutes and pull forward. And rest. Okay, so next we're going side to side. So it looks like this. You'll be standing on one foot. The other leg will go, again, the ball's in the same place, or the sock's in the same place. And then going behind, okay, knee is still centered. And then we go out to the side, and we're always using the glutes. This is what it looks like from the side. Okay, so first we go behind, this front leg, knee is centered. And then leg goes to the side, straight line. And always remember, it's the buttock muscles that are doing the work. Okay, we're going to do 2 reps here. Left leg supporting first, so the ball in the right foot, forefoot. Foot behind a little. And you go cross behind, kind of like a curtsy. And then slide out toward the right side, keeping the left knee centered. Use your left glutes to come back, not your right groin muscles. Leg behind, left glutes. Left glutes, bring the right leg across. Keep left glutes, not right groin. Left glutes, not right psoas, and leg back. Good. Okay, that was fun. Have a good time and hope to see you next week. Thanks for coming.